Hello there, good evening, welcome to the clinic. We have a few medical tests to run tonight, so just looking at my list here. The first thing I want to look at is the range of tests on this near vision chart here. Looking at these blocks of text, please tell me the smallest block that you can read down to. Bring it a little closer. Just try the one below that one, please. I'm going to point to some plates with some numbers on. Please tell me the number you can see on that particular plate. That's fine. Cover your left eye with your left hand. Please have a look at the spot in the centre of the grid and tell me, do you see any distortion to the wide lines? Okay, please cover the right eye with the right hand. Keep looking at the central white spot. Any distortion to the vertical or horizontal lines there. Okay, that's the first test completed. So we have near vision. These three coloured plates. We will be checking your colour vision in a little bit more depth later on. And the Amsler test. Next, I'm just going to have a feel of your scalp for any lumps or bumps. Just adopt a normal position and relax. Just behind the head. Yep, seems all in order. Let me have a look at the reflex of the eye, the retinoscope. And also the media. Just look off behind me. Excuse the flashing lights. Okay, I'm going to introduce some lenses now, just in front of the eye. Just keep looking off straight. Let's try and place this just in front there. And finishing for your left eye. Try and line this up. Okay, just accounting for the working distance there. I think we have a planar prescription in both eyes. So you don't wear any optical correction at the moment for distance, I assume. Thank you. Alright, what do we have next? I'd like to have a little look inside your mouth. A non-invasive test. Just open wide for me, please. Okay, raise the tongue to the roof of the mouth. Okay, tongue to the right hand side. And to the left. Okay, just relax the tongue in the centre. Okay, just say ah. And again. Okay, thank you. No lesions found in the mouth there. Uvula, that's fine. Okay, just a quick one here. I'm going to have a look at your pupil sizes. So I have a little scale there. I'm just going to rest this just against the forehead as you look back at me, please. And utilising the pupil gauge. 4 mil on the right. 4 on the left. I could just bring the house lights down a little bit. Let me recheck. 6mm size there. So absolutely fine. We'll check the light reactions shortly. I would like to check your sense of smell next. I have 3 samples for you to sample. When I say, just breathe in through the nose, please. Okay, in through the nose there. Of course, that is coffee. Okay. Just sample that one there, please. Correct. That's rosemary. And your final one, please. Breathe in there, through the nose. Excellent, that was a lemon. 3 out of 3. Fabulous. So, coffee. Tick. Rosemary, tick. And lemon. Right, we have some more ocular tests coming here. First, I'm going to check your convergence. Just set up this piece of equipment. Okay, I'm just going to rest this on the bridge of the nose. Looking here, you'll see a line. I want you to follow the dot in the centre of the line, please, as close as you can, and tell me if you see any double vision of the line. Are you ready? Just ignore the shadows there. Okay, one line, thank you. Okay, I would like you to look towards the print at the bottom of the drum there. Please tell me when the print first becomes blurry. So is it clear there? Okay, and tell me when it becomes clear. And when it blurs. Amplitude of accommodation is age normal, and convergence pretty much to the nose. Excellent. That was a binocular amplitude test, of course. did say at the beginning we were going to further investigate your colour vision. Let me have a look for my little colour vision booklet, please. So on these pages you may see an image, you may see numbers, you may see a word. Just please say what you see. Okay, are you ready? Say them, please. Not the colour. Good. Good. Some numerals. Correct. Okay, are you ready? Okay, couple here. Okay, so it sort of looks like a stained glass window. Excuse the reflections. Very good so far. We'll do one more. Fabulous work there. Binocularly pass. It is very important that I look at your ocular structures now. Coming a little bit closer with some light. We did say we were going to check the pupil responses, so I'll do that first. So look off just behind me, please. Right direct. Left direct. Right eye consensual. Left consensual, and the swinging test. Excellent, and as promised, have a look at your ocular structures now. Coming a little bit closer. Just look into the light, please. Okay, and I'm looking at structures. And the vessels there. And just at the neural retinal rim crossing. Super duper. I just change the base on this. Battery's just running a bit low, but we have backup. Okay, just try and look off behind me again. Lens, optic nerve. Just look into the light. That's the macula. Good. Three to four. No nicking. Thank you. I'm going to finish off with some hearing now. We use the tuning fork here. I'm going to ring the tuning fork, place it next to the ear. Please tell me when you stop hearing the ringing sound. Are you ready? That's what you're listening out for. Are you ready then? Okay, and for the left. Lovely. I'm going to place the tuning fork just on top of the head after ringing it. Let me know if the sound is heard equally between the two sides or if there is some disparity. Here we go. You feel that's equal? Fantastic. So I'm going to take the final few notes, but rest assured the results are normal. And ophthalmoscopy and pupillary light reactions. And I'm just going to do some annotations for the ocular health findings. this bright foveal light reflex at the macula. So I want to thank you for coming in tonight. I know it's late, but it was important that we got through those tests.